1 in 6 of us will suffer a stroke in our lifetime. It is the leading cause of long-term disability in the U.S. The good news is that effective treatments exist and can reverse the impact, but they have a time window and can only be administered in a hospital. Unfortunately, the majority of people don't get to the hospital in time to receive treatment because they don't call 911. When a stroke presents, people realize they're having a health problem, but they often don't recognize signs as a time-sensitive medical emergency and call 911. In fact, studies show in about a third to half of all strokes, people seek out non-emergency medical care by calling their primary care physician or driving to urgent care. A typical scenario:
my husband is not feeling well. He's having trouble with his arms. He's feeling weak and he's not speaking properly. Can I get an appointment right away?
Medical office staff answering the phone or checking in a patient aren't routinely looking or listening for stroke signs as part of their jobs. Consequently, an appointment is given for later that day or the next. Meanwhile, the stroke is progressing, killing 2 million brain cells a minute, and the standard treatment window of 4.5 hours is slipping away. The result: somebody that might have benefited from treatment may be permanently disabled or die. To reduce pre-hospital delay in stroke treatment, primary care medical practices are important partners. Consequently, the Virginia Stroke System Task Force, in conjunction with the Medical Society of Virginia, the Virginia Department of Health, and the Virginia Hospital and Healthcare Association, have approved a Stroke Smart Medical Practice Standard of Care, which consists of 5 easy actions for a medical practice to adopt. Action 1. Staff training. Educating all staff, particularly those answering phones and checking in patients, to listen or look for signs of a stroke. If the patient describes any signs, a stroke smart medical practice would follow the practice protocol to call 911. Action 2. Phone system. Modifying the voicemail or on-hold message recording to describe stroke signs and advising callers to call 911 if they suspect an emergency. Here is an example.
Thank you for calling Mary Washington Primary Care. If you are calling with any of the following symptoms, you may be having a stroke. Is one side of your face uneven or drooping? Is one arm weak or numb? Are you having difficulty speaking or understanding? If you are experiencing a stroke or other life-threatening emergency, please hang up and dial 911 immediately.
Action 3. Patient education. Provide stroke smart materials to your patients. You can place the materials in the waiting room and/or hand the material directly to your patients. Since the CDC reports that 80% of Americans visit their medical provider every year, it's an excellent place to educate patients to become stroke smart. Materials can be ordered at no cost on the VDH website, or the practice can produce their own. Action 4. Flag high-risk patients during intake. The electronic medical record can flag high-stroke risk patients, or the nurse can determine this based on patient history. They can specifically educate the patient on stroke awareness and provide them a stroke magnet or a wallet card for reinforcement. Action 5. Measurement. Track progress at the practice level. This may be the number of magnets or wallet cards distributed to patients, number of appointment call-ins that were suspected strokes, or the percentage of personnel trained in stroke signs. As part of Stroke Smart Virginia, the Medical Society of Virginia, the Virginia Department of Health, and the Virginia Hospital and Healthcare Association are all encouraging all health systems and physicians' practices to consider this best practice. We are available to help you get started. It requires no provider time and easily fits into your workflow. As of this filming, the following health systems have enlisted practices to become stroke smart: Inova, Mary Washington Healthcare, VCU Health, Bon Secours, and Augusta Health. If you can spot a stroke, you can stop a stroke and save a life.